Right. It's 11 o'clock. Welcome, everybody. Hopefully you can all hear me clearly. So we are going to get going. So welcome to today's session in collaboration with Conveyancing Data Services on Radon. My name is Danielle, so thank you for joining me today. I'm just going to start off with a little bit of housekeeping before I get going. For those of you, you should be able to see a control panel on the screen, which allows you to ask written questions. Please feel free to submit questions as we go along, and I'll try and get them answered either during or after the webinar. We are recording today's session, so if you'd like a copy of the recording or a copy of the slides afterwards, please do let me know, and we will get those over to you as well. I think everybody is kind of I'm still working from home. There's people working in the offices. It's a mixture of both. Hopefully you're able to hear me clearly. Apologies if there's any background noises, but I am still working from home. But I hope everybody's safe and well wherever they are. And finally, as always, we really value your feedback when it comes to any of our presentations. So there will be a quick survey. It'll take you a few seconds to answer that will launch after this webinar, and we'd really appreciate it if you could give us some feedback to make our presentations better in the future. So let's get going. So today, this is our agenda. Today, we're going to really try and cover all of the basics, what radon is, where does it come from, why is it important to know about, particularly in the conveyancing process, and how we actually go about investigating it, how we reduce it, and we'll also take a closer look as well as the data that we put in our reports to give you a better understanding of the different kinds of radon data that's available and some of the benefits of more property specific radon data. So let's get going. So what is radon? It is a colorless, odorless, tasteless gas. You can't see it, you can't smell it, you can't taste it. This is why you need special equipment to detect it. It comes from the rocks and soil found everywhere in the country. The radon level in the air that we breathe outside is very, very low, but it can be much higher inside buildings. Now, the natural breakdown of uranium in soil, rock, and water gets into the air that we breathe. Radon typically moves through the ground to the air above and into our homes through cracks and other holes in the foundations of buildings. Now, radon can also enter your home through well water. So it depends on obviously where you get your water sourced from. And your home or a building can actually trap radon inside, which is why the levels build up. Radon levels are pretty low everywhere outdoors. In most cases, the level of radon indoors is also low, but depending on which part of the country you're in, and we'll talk about that a little bit later, you can see the prevalence of radon getting much, much higher. It also depends on things like, what the building that you're in is being used for. So all of these factors can affect radon levels in some way, shape, or form. Now, where does radon come from apart from the ground? So we're all exposed to it on a daily basis. This isn't really a problem when we inhale it in the open air, but it can pose a health risk when we are indoors. Now, majority of the radon that we're exposed to does come from the ground. So just about half of the average annual radiation dose to people in the UK comes from our exposure to radon. Again, it's naturally occurring. You can't escape it when it comes from the ground. And it's basically, like I mentioned earlier, that radioactive decay of natural uranium. You can also get it from different sources, as you can see on the screen. 16% comes from medical radiation, so that could be things like a CT scan or X-rays, or some types of cancer treatments to provide palliative treatment to patients by shrinking cancer cells down. So there's all sorts of medical radiation that we do come into contact with, but obviously it's very low in relation to, let's say, the comparison from the ground. You even get things like radon that comes from food and drink. So naturally occurring radioactivity is transferred to things like crops and animals from the rocks and minerals present in the soil. Drinking water can pick up radioactivity from the earth. Fish and shellfish can take it up from the water or the sea floor. And similarly, of course, man-made radioactive materials can get into food after it's been discharged into the environment and it passes through the food chain. So, there's things like that, certainly things that people wouldn't necessarily think of. And then you have a very, very small percentage that comes from things like nuclear fallout or occupational exposure or even permitted discharges. So uh, another contributor to average annual doses is from regulated discharges from industry and hospitals. Things like civil and military operators are permitted by the environment agencies to discharge some radioactivity contaminated gases and fluids into the atmosphere and watercourses. Any radioactivity discharged into the environment is carefully monitored and controlled, and over time, such discharges have actually reduced considerably. So yeah, so it is everywhere, but primarily it's going to come from the ground. Building regulations covering radon protective measures for new dwellings in the UK were first introduced actually for the southwest of England in the late 1980s, for Derbyshire and Nottinghamshire in the early 1990s, and then for the rest of England, Scotland, and Northern Ireland in the late 1990s. The gradual introduction of measures reflected the way in which the UK was mapped, targeting the worst affected areas first. And so as you can see on the map on your screen, you can see there's dark shaded red and or brownish red areas and lighter areas, and of course the darker shaded areas are where radon is very, very prevalent. So you see big strips of it. There's obviously a lot of it in the southwest. There's patches of it in Wales, up in the northwest, certainly a big strip of it going through Birmingham and the Midlands. And so you can see it is really kind of depending on where you are in the country that it's going to be much more of a concern. So why is it important to investigate radon? So radon is a standard question in the conveyancing process. It's included on the Con 29 form and appears in section 3.14. However, the data used within this particular search, so the Con 29, isn't very specific. And the answer to the question is based on the 1 kilometer indicative radon atlas for England and Wales. We will look at examples of the radon atlas a little bit further on in the presentation. And we'll also look at the different types of radon data that's available and why it's beneficial to look at different types of data and not just what's on the Con 29. Now, if radon is present in the property, measures may be needed to be put in place to reduce the levels and exposure. So measures which unfortunately at times can cost money. On the flip side, your client may be able to negotiate a reduction on the asking price if radon is present within the property and measures are required to reduce the levels. So this is known as a radon bond or retention. For commercial premises, if you are working in the commercial conveyancing industry, there is an additional responsibility that the employee needs to be aware of. So work environments vary greatly in size and nature, but excessive levels of radon can occur in almost any type of workplace. And the amount of radon that collects in buildings depends on its location, depends on the type of structure it is and how it's used. Now, if the building is identified to be in a radon affected area, then testing should be undertaken by using radon detectors. And the number of detectors required for testing depends on the type and size of the workplace, and further guidance on this and purchasing the detectors can be found on the UK Radon website. Now, if the detectors find that radon levels in a commercial building exceeds a certain threshold, then regulations covering ionizing radiations apply, specifically the Health and Safety Work Act 1974 and the Management of Health and Safety at Work Regulations 1999. So slightly different things to be aware of for commercial versus residential. So I mentioned earlier the Con 29, but there is also another document in the conveyancing process that has radon in it, and that's the TA6 property information form, which is completed by the seller. Now, I'm sure you're all very, very familiar with both the CON29 and the TA6, and I'm sure you're all very aware of the phrase caveat emptor, which translates to buyer beware. As this form is completed by the seller, an element of caution should be exercised. The TA6 covers the following in section 7.4 and 7.5. So you've got 7.4 has the section says, has a radon test been carried out on the property? So it's a simple yes or no tick box. And if yes, a copy of the report is requested, as well as asking if the test result was below the recommended action level. And then you've got 7.5, which asks where any remedial measures undertaken on construction to reduce radon gas levels in the property. And then, of course, a more precise way of identifying if a property is radon affected is going and getting an environmental search. So all of our reports actually include property-specific radon information as standard, just because I think it's a kind of a very relevant part of the environmental process as well. And greater granularity that we can provide you, in addition to what you can get in the CON29, is only going to benefit you and your clients. So how can radon actually impact us and our health? How does radon enter a building in the first place is probably a good place to start. So because it's a gas, it's able to move through spaces very easily in the soil, fill material around a home or a workplace's foundations. Now, most buildings tend to operate under a negative pressure. This is especially true in the lowest portions of a building, and also when it's warm, it's warmer outside. So this negative pressure acts as a vacuum, and that pulls soil gases, including radon, into the lower levels of a structure. Some causes of a negative vacuum could be things like hot air rising, wind blowing past a building, air used by fireplaces or even wood stoves during the winter. In a basement, of course, as I mentioned, there's a lot more pressure in the lower parts of a building. So if you have something like a basement, it can collect a lot more there as well. And then, of course, once it enters a building, it moves very, very freely indoors, where, of course, we can all breathe it into our lungs. But radon moves by diffusion and natural air movement. So things like opening windows or doors or forced air ventilation systems can push it about and move it around in a building. And long exposure to radon can be detrimental to your health. Of course, any exposure to radon is thought to be a risk to health, full stop. High levels of radon can cause lung cancer, particularly for smokers and ex-smokers. And radon produces tiny radioactive particles in the air that we breathe. And radiation from these particles damages our lung tissue over time. And so again, it's really thinking about the level of radon and how long you're actually exposed to it. And so, of course, the longer your exposure, the greater the risk is going to be. A European study funded by Cancer Research UK and the European Commission showed that radon in the home increases the risk of lung cancer. And in an independent report, Radon and Public Health estimated that radon is a cause in over 1,100 lung cancer deaths each year in the country. So again, there's all these different studies, and this is why people, deem it quite important. Having said that, do take that with a pinch of salt, because at this point in time, the studies all show varying degrees of risk, and there is no single consistent piece of evidence that says radon is 100% causing a lot of lung cancer anywhere. So like we say, it can impact your health. So it is good to know whether or not you live in a radon risk area. And if you do know that you're in a radon risk area, be aware of what the levels are in your home, which is why we encourage people to get radon measured. And if it is high, then what steps do you need to take to actually get it reduced? So those are things that we want to make sure people are aware of. Now, how does radon actually get investigated? So the action level, you see a lot of referrals to action levels in the radon reports or in the radon data section of our reports. So action level refers to the annual average concentration in a home. This averages out short-term fluctuations. Tests that are carried out over shorter periods of time will have a greater level of uncertainty and are more likely to lead to ambiguous and inconclusive results. Tests are done to determine exposure. This is why we do recommend testing areas in a home like the living area and the bedroom, as these are the rooms that a family would most likely use. Radon detectors are really safe. They're really easy to use. They can kind of just sit on a shelf. The hollow plastic shell, which is kind of what you see on the screen, contains a piece of clear plastic that records the radon levels. The detectors themselves don't actually emit anything. They don't collect anything dangerous. However, they can be damaged by things like heat or submersion in water, and they shouldn't be opened. And also, the levels of radon can very much be influenced by ventilation. So it's not advised that when you're doing these tests and you're putting them in places around the house, don't put them near windows or doors, or don't put them high up. So UK Radon will aim to post the results and an explanation to your client within 4 weeks of you returning the detectors to them. And the result will give you the yearly average radon level in a home, and will tell you whether it's above or below the action level. So the recommended time is at least 3 months, if not longer. So it really depends on obviously what your client wants, but testing isn't too expensive. It just takes a little bit longer. So as I mentioned earlier, the most accurate test should be conducted over 3 months, which when you're in the middle of a transaction could actually cause some delays. So radon can easily be reduced for a fairly small sum of money. It is recommended that where time is of the essence and the purchaser wishes to undertake the accurate 3-month test, a radon retention or bond can be put in place to allow the transaction to progress and not be stopped by radon itself. So I have heard in the past that some people have done this, and usually the radon bond is anywhere between 500 and 2,000 pounds. I'd like to think that was reasonable. In terms of the action levels and the reducing radon, we'll talk a little bit about action levels. So in our data, you'll see these terms described to you. The area will be in an estimated radon level, and you see the various percentages on the left-hand column: less than 1%, 1 to 3, 3 to 5, 5 to 10, 10 to 30, over 30. Is protection required? Yes or no? And what is the level of protection? None, basic, or full. So when required by building regulations and associated guidance, new build properties in a radon affected area are expected to have radon protective measures installed when they are built. Now, the guidance recommends specific protective measures depending on the construction of the building and whether full or basic radon protection should be provided. Now, you can find out whether you should have full or basic protection by asking the builder or by doing a radon search like we provide. And the radon search will state whether the radon protection expected is basic or full. And again, you can see the explanations on the right hand side when we mean basic or full. So, we will provide the breakdown of where you are, where the property falls in terms of estimated radon level and the appropriate levels, appropriate steps that need to be taken. Now, UK Radon have a really useful interactive tool to help you work out whether you should reduce your radon levels and how to go about doing that, what method. So that link on the bottom left hand side is the tool. Some simple actions such as sealing around soft hatches or sealing large openings in floors and extra ventilation don't necessarily reduce radon levels on their own, but when you combine it with other effective measures, they can improve the reduction of radon levels. Completely sealing floors is really hard. It's a really difficult thing to do, and it can actually cause rot in wooden floors. So the diagram on screen is intended as a guide, and the environmental health department of your local council may be able to also offer advice. For levels in excess of 1,000, you may wish to contact PHE for advice. So, there was a joke about how, if you open all the windows, you just be fine. That's not necessarily true. Things like a radon sump should be fairly easy to do in addition to adding to your ventilation. Now, I mentioned earlier about data, right? So in the next few slides, I'm going to show you some examples of radon data applied to properties in different parts of the country, and you'll get a feel for the different kinds of radon data that's available and why it's good to understand the radon data that you're looking at or you're using. So on this map, this is a building in Ruthven in North Wales. It's quite zoomed out, and the building that we're talking about is symbolized by that yellow star that you see on the screen. So this map already has the radon potential data set applied to it, which is property specific. You can see that majority of the area is within an area of less than 1% of properties being affected by radon. So there is that small area that you see on the screen in the middle, or in the middle of the image, which is 3 to 5% of properties of potentially affected by radon. But you can see here, this is what the 1 kilometer radon atlas looks like overlain on top. And you can observe that the entire 1 kilometer square on the sort of right hand side of the image is actually listed as between 3 and 5% being affected by radon, even though majority of the square is less than 1%. And you can see the small area of the 3 to 5% in the middle still there. So that's kind of where property specific data versus the 1 kilometer radon atlas, which is in the CON 29, or is what's used in the CON 29, the advantages and disadvantages of that, because what they'll do is take the highest rating within that 1 kilometer square and apply it to the whole square. So, which is good for an overall view, but not necessarily good in terms of accuracy when you're looking at specific properties. So again, this is another example. So this is the image of an office in Bolton. The property itself isn't in a radon affected area. It's less than 1% in that white area. So it's a very, very low risk area. The yellow area in the top right corner represents an area which is 1 to 3% of properties, which of course contain higher levels of radon. So this higher level of radon is still within the low risk where no protection measures are necessary, which is good. But again, when you look at the 1 kilometer radon atlas, which is what's used in the CON 29, you can see now how the entire 1 kilometer square is now 1 to 3% as opposed to less than 1%. So this is, again, not necessarily representative of the actual risk, as it was only a small area on the top right-hand side. So hopefully you start to get a flavor of what the different data sets are and why they're actually really useful. Again, another example. So this is in Manchester, and it's obviously quite zoomed out, but you can see we've outlined an office building in the red boundary. So this map already has the 1 kilometer data atlas applied to it. You can observe that towards the right, the entire 1 kilometer square is between 1 to 3%. But again, that's not necessarily true when you drill down into the more specific, property-specific data set. It's only a small percentage of it. So it is really, really important to understand when you're looking at the radon data in a CON 29 versus looking at the radon data in, let's say, one of our reports. That's why there will be a difference sometimes in the results. So this image here, that's in Wales, and the property is in a radon affected area, as signified by the color. It's between 3 and 5%. So we would recommend that if you are purchasing a property in this area, you should of course investigate radon further. But if we zoom out a little, you can still see the majority of the area is still between 3 and 5%. However, there's that white bit that's south of the building in question that's less than 1%. So no further steps in regards to radon would be recommended in that area. And again, if we zoom out a bit more, you see several more areas. You get to get a bigger, better picture of what the radon data actually looks like. And so this is why it's really key to understand why radon specific data is property specific radon data is really, really helpful when we're looking at radon. And so again, you go from this image, which is property specific, to the radon atlas, which is a lot more generalizing of the actual ratings applied to property. So it's always good to understand how the data differs. In terms of reports and availability and what reports are available, as I've mentioned earlier, all of the Groundsure reports have radon included as standard. So whether it's the all-in-one Avista, which is what you see on the screen, which covers you for everything, 7 different searches in one, or if it's a step down to the home buyers, also still includes radon. We think it's important enough that it should be included every single time. So that's actually also the same for commercial. So regardless of whether you're looking at resi or commercial, be rest assured that radon is always included for you. I just got a question in from Mr. Edwards. Absolutely, I will have copies of slides and recordings sent out to everybody should you request that and should you need that, so not a problem. And that's pretty much it for me. So nice and short today. I really hope you found today's session helpful. As you can see, there is a lot of difference depending on what radon data you're using, so we hope that helps you demystify and understand what radon data is and what it looks like. And that's pretty much it. So thanks very much for joining me. Thanks very much for joining me today. Any questions at all, please feel free to reach out to us, and have a great rest of the afternoon. And if you could just take a few seconds to, oh, wait, hold on. I've just got another question come through from Miss Doreen Burton. So does radon move around? Yes. It is a gas. So yes, absolutely, it does move around in terms of if we're talking, does it move within a building? Yes, it moves. It moves just like the air does. In terms of underground. So underground, no, that I from what I understand, and I can always double check with our consultancy team, but basically it really depends on the geology of the actual ground that we're on. So it's depending on how much of a particular mineral is on the ground, and that's basically what releases the radon gas. So hopefully that's helpful. But like I say, I will send out a recording, copy the slides, and I will also double check that underground question for you. I've just got another question come through. Would the remedial works eradicate radon gas from the property and its surroundings? So thank you for that question. Remedial works, actually, you can't get rid of radon because it's in the ground, but what it will do is make sure that your exposure to radon within a building is not going to is at the lowest level possible. That's what it does. So unfortunately, it's not something we can get rid of or eradicate completely because it's naturally in the air, in the atmosphere around us. What we can control is how much exposure we have to it indoors, which is what the remedial works does. It basically makes sure that there's enough ventilation, and it redirects any kind of higher level gases outside of the property so that when you are indoors, your exposure to it is actually a lot less. Does that make sense? But if hopefully that makes sense. Right, I've had another question through. Wow, lots of questions today. So if I've had another question through. So that says, if a property was in a 1% area close to an area that's 3%, there is no chance of the 1% area becoming a 3% property. As far as I'm aware, Doreen, that is correct. Unless Public Health England decide to change the data or the ratings, the areas that are designated based on the data that we have will stay the same, basically. Right, I think that's everything. Any other questions before I go? I think that's it. Perfect. Thank you very much for joining me today. As I said, I will send a copy of the slides and the recordings to those who send that request. And if you could give us some feedback, that'd be wonderful. Thanks very much and have a great rest of the afternoon.